Hello everyone. My name is Hua from ShangHai 30th People's Hospital. I'm pleased to have a chance to share something with us. Now let's begin. The title of the case was Contrast Enhanced Ultrasound of Combined Hepatocellular and Intrahepatic Cholangiocarcinoma. A female, 16-1 female, the focal examination found a focal liver mass for 8 months and proposed to liver abscess to our hospital. This patient had some low fever, low abdominal pain, low jaundice, and the temperature became normal after antibiotic treatment. And there was no significant change in her body weight. The related inspection, we can see that in 2019 January, the US gave us the focal liver mass. The size was 33 times 28 millimeter. After that, the chest CT also found the mass. Because of this patient have no other obvious symptoms, so she paid low attention to this mass. And 8 months later, she go to hospital again, and this time the enhanced abdomen CT diagnosis as liver abscess. And the laboratory test showed only the CRP and the white blood cell was a little elevated, and the AFP and CEA was normal, while the CA199 was significantly elevated. So we gave this patient the conventional ultrasound. From the conventional ultrasound, we found a focal liver hypoecholic mass in right lobe. The size is very big, and the mass is heterogeneous with irregular, sharp, and clear boundary. No echo halo can be seen around, and 6 strong halo can be seen inside. The color showed a little blood flow inside. After that, we give the contrast enhanced ultrasound with solar view 1.5 millimeter. For the artery phase, we can see this mass with rapid hyper enhancement. And in the next phase, we can see this mass showed a hypo enhancement. In the artery phase, this mass showed rapid heterogeneous hyperenhancement with thick ring and with distortion of irregular blood vessels. While in the portal phase and in the delay phase, this mass showed heterogeneous hypoenhancement. From the CUS, we can give the diagnosis. This mass must be a malignant tumor, but what is it? ICC or HCC? In order to get a final result, we give a biopsy, and the pathology gave us the answer. It was a low differentiated carcinoma with multiple focal necrosis, combined with HE morphology and enzyme labeling, tending to be complex carcinoma. That means it was a HCC and ICC. The immunohistochemical also support the answer. So, what gave us some discussion is that HCC always have increased AFP after HBV, hepatitis, and cirrhosis. And ICC was mostly without background of cirrhosis, and the CA199 was increased. And also in CUS, ICC mostly showed high enhancement with peripheral ring, earlier regression, and low distortion of the irregular blood vessels. What we should keep in mind is that when the relevant examination is inconsistent, we should keep in mind that the possibility of mixed liver cancer should be considered. That is my case report. Thanks for your attention.
Thanks, Dr. Xiangli Hua, for your presentation. Now we would like to have Dr. Chen Ling to comment, please.
Dr. Xiangli Hua, thanks for your excellent presentation. This is a real case. From your speech, we know of grayscale, CDFI, and CEUS of a combined hepatocellular and intrahepatic cholangiocarcinoma. In your speech, you state that the pathological results of this case is a complex carcinoma. So I want to know how you obtain this result by biopsy or surgery operation.
How to perform the biopsy?
How to obtain the pathological result? Pathological result. How do you obtain?
We can see that from the HE, actually the diagnosis of HCC and ICC is mostly depending on the HE morphology, and also the immunohistochemical can give some diagnosis, and we can see that the FP was positive, and the FP alpha is little positive, and CD34 which means vessels was negative. All of this was the reason to diagnosis as HCC, and the others was to diagnosis as ICC.
I just want to know, did this case have been performed biopsy or surgery operation?
We just gave this patient biopsy because this mass is too large, and if this was diagnosis as ICC, it should not be get surgery.
Could you please explain why this case have the above CEUS features based on the pathologic results?
Just as I see in this CEUS, we give the examination of CEUS. We just think it as an ICC because of the high enhancement and the early regression and with peripheral ring, and I didn't think it as a HCC. But what make us have some suspicious is that there was a regular blood vessels. So it's very confusing us. So we gave this patient a biopsy.
Thank you.
Thanks, Dr. Chen Ling and Dr. Xiangli Hua.